All right, guys, we're going to go ahead and get started, and folks will log in, as we're kind of going through a bit of a short introduction here. But welcome to our live webinar with MyMD Connect. I'm Marcus Malone, VP of Sales at HRO Resources, and we're excited to talk to everybody today about addressing rising healthcare costs with innovative direct primary care. We've got Dr. Jeremy with us. Happy to have him on with us today and share his expertise. Before we get right into it, just a quick introduction to who HRO is. So we're really a one-stop resource for our clients, and we help them create efficiencies and evaluate cost on a broad scale in many different areas of their business. And some of the key areas that we focus are employee benefits, risk management, technology, payroll, and human resources. And we really work with companies from all different sizes and different stages of their life cycle. So we help companies with 2 employees on up to a few thousand employees. And just to kind of highlight some of that versatility, here's some recent wins that we've had this year with companies in different phases, different industries, different sizes. We worked with a 30-employee industrial distribution company that we saved 18 grand annually in administrative cost around HR and payroll. We had a 100-employee oil and gas company that we saved over $150,000 annually with our multiple employer 401k plan. And then a larger group, we had a 700-employee auto dealership where we saved $1 million in annual healthcare costs. So a lot of different ways that we can help. We'd love to help you guys if we can be a resource to help you grow your business, navigate through these challenges that we're all facing. So we're going to go ahead and jump in with Jeremy. And before we get started with Dr. Jeremy, we're going to play a short video. It's about 4 minutes, and it's really a great introduction to what these guys do and what we're going to be talking about today. So let's see if I can get the video up and rolling here real quick.
Our patients literally have their doctor in their pocket on their smartphone. They are 2 clicks away from securely accessing us by real-time text. Access can't get any better than whipping your phone, asking a direct question to your doctor. That's the level of access we've achieved today. Almost always we can find $100 a month in savings. If you're on 4 pills, I promise you I can save you money. Where was all this money going in the first place? It was going to the guy at the pharmacy place. It was going to the guy at the insurance. It was going to the 15 guys in the room that didn't need to be there. We've fired all these people. So that's where the value is. It's great. I'm Jeremy Smith. I'm a family medicine doctor. I've been a doctor for 11 years. 8 years into my career, I realized this has got nothing to do with why I wanted to go into medicine. I was seeing 40, 50 patients a day. You're only spending 4 to 6 minutes at a time with patients. You can't possibly do a good job. I literally sat in a room, drew a box on a piece of paper, signifying the room that the service was to be done in, and drew 2 things, a patient and a doctor. All of these other people that have shoved their way into the patient-doctor relationship, they got kicked out of the room. There's no insurance man, there's no government man, there's no pharmacy guy. And what I found out was patients loved it. This is exactly why I went to medical school, and the word spread like wildfire, and they said, oh my God, here's a doctor that actually cares. Because I had time, an hour, I could sort through all their problems, not just the one that I could knock out in 4 minutes. We sit down in a relationship format, which is the way it's supposed to be, and it makes the medicine very easy and very satisfying. We need you to engage, form a relationship with us, and then anything that you need from a medical standpoint, let us be the first point of contact, no matter what it is. You need an advocate, you need a consultant, and if that's a doctor as well, you've got the perfect guy to address your needs. Every time you go to the pharmacy, you're being fleeced. We don't use non-transparent, dark world pharmacy benefit managements. We take our plans and we put them with an honest, transparent pharmacy benefit management company that does a service for a fee and doesn't steal any of the money on the back end. I don't just say, okay, you need a blood pressure pill, try this one, send you to the pharmacy and hope that you can pay for it. Instead, same steps, you need a blood pressure pill, let's try this one. But before you leave, let me log into the pharmacy. Let me look at exactly what your out-of-pocket cost is going to be on this. And wow, if we find out it's too expensive, don't leave. Let's try another one. Let me as a doctor figure out what's the best thing for your heart and your wallet at the same time. What happens right out of the box is you're contacted by email or by phone by a doctor's office. Hey, we're a doctor service. We want to take care of you. You don't even have to leave your office. We can do this on your phone. We can do it on your computer. Fill out your patient paperwork. All you got to do is click a link. We can arrange someone to come out and draw your blood. We can send you to a local draw station to get your blood work done. Your employer will pay for the whole thing. It doesn't cost you anything.
All right, so that was a really good introduction. Thank you guys for sharing that video. Kind of gives us a good jumping off point for our conversation today with Jeremy. So Jeremy, welcome, and we'll turn it over to you.
All right, Marcus, hey, I appreciate that, and everyone that's tuned in, I appreciate your time, and we'll try to respect that today. So that video we shot a few years ago, and those are segments out of that, and it opens up probably a 3-hour talk that we could do, but we're going to try to focus on just taking that concept of fixing the medicine delivery system, and we're experts at MindMD Connect at putting that into a product that an employer can actually get and extend benefits to the employees. But the theme is we take that direct primary care relationship, which makes sense, and then we've bolted that and built it in as an integral part of health plans for employers. So concept is patients need access, and having your physician in your smartphone is the definition of that. And it's been an amazing thing. So 24/7, your employees or you as a patient need access to the doctor, and you and the doctor need to sort out what's the need, whether it's acute or chronic, and what is the best plan to go forward. And so that's a 24/7 access that we've got with all of our MindMD Connect doctors. So Marcus, if you'll go ahead, push the slide forward. So direct primary care, if you're not familiar with it, is the fastest growing part of medicine. You guys probably know doctors are about the most unhappy folks out there in the service industry, period. And a breakaway from that fee-for-service world that I used to practice in is the fastest growing part of medicine. When I did that about 6 years ago, there was no acronym for it, but there is now. It's called direct primary care. And the basics are, look, go back to just the doctor and the patient. Start there, figure out what's needed, and then we can build out from there. So that's the direct primary care. We did that with brick and mortar and nice settings and everything, and that spread, that concept and that business model is spreading crazy across the nation, and doctors are starting practices everywhere with just a DPC relationship, and that's a membership-based practice, so that can be bought by anybody. The other form of that is, as we started taking care of patients in that DPC form, we realized 90% or better is just being done in the virtual space. We all have one-on-one platforms on our phones that are ACA compliant, very technologically advanced, and fit into our tech stack. And we're enabling patients and doctors to be put together through MindMD Connect. So that's virtual primary care. And then you take those two things, virtual direct primary care and DPC, and you can put either of those in the middle of this health plan. This picture on the side shows the hub of that is the DPC doctor. Now that is not an average doctor. That's a doctor with a skill set that understands the finances of medicine, the economics of medicine, furthermore understands that a health plan is not some mystical rich insurance guy that owns all, has a bunch of money and he's just hoarding it. No, it's, most employers are paying for the benefits of the health. So if we kill the health plan, we're going to kill the company that you work for. So our direct primary care doctors, they're highly trained at understanding what benefits are, how the benefits are put together, and all the pieces necessary to do the advocacy up front. Every other health plan is you go to the doctor gives you some instruction, an order or a prescription, and then it's like, good luck. That doctor has no idea how your health plan's put together, who's paying for it, et cetera. So the big difference here and why this is so effective at saving money is that at that point of service, you can avoid all the downstream problems and avoid a lot of the advocacy that's needed just by having the doctor informed of two things. He already knows how to take care of the patient, but if he knows how to do that in the context of what's available through the health plan they designed, it works out really well. So both of these things fit in well with our health plans. If someone already has a health plan they're satisfied with, certainly they can bring in just the DPC component and have it more or less bolted onto a solution that's already working for them. So that's our DPC memberships. And again, they come in two forms: a virtual only membership and a full brick and mortar DPC membership. So as an employer, you have a choice. Either way, you can put MyMD Connect in place for your employees, either on its own or built into some of our plans. So Marcus, if you'll step forward, we'll go through some of those plans. We've got three major classes of plans. The first class is what we call a routine care plan. And these take care of basic lab and x-ray, imaging, the day-to-day things. They're designed to cover the day-to-day needs, about 85% of everything that's needed. So it's a direct primary care doctor, specialist, other doctors that are needed to be seen, urgent care visits, things like that. And they're all ACA compliant. So they have preventative care and they've got all those things built in. But again, the hub of that plan is the most valuable piece. It's that direct primary care relationship that we're extending to all of the employees as beneficiaries. The next slide has our second set of plans, and it's a little bit different structure. They're also the goal is to set up for everyday needs, but this type of health plan exists outside of the requirements of the ACA, and they're just HRA plans that are built around the MyMD Connect DPC doctor. So an employer can set this up however they want, but we've got kind of three levels of standard plans. Again, labs and imaging can be reimbursed by the employer. CT scans, MRIs, reimbursed by the employer. We've got our own drug program that does not even need to be reimbursed by the employer. But that HRA is set for if you can't afford the big health plan or you're not over 50 and are not required to. These HRA plans are really they're pretty cool plans, and we've had good success designing them. And then finally, we've got major medical plans that we design the entire chassis from the bottom up. Again, starts with the direct primary care doctor, and then it layers on the major medical aspects. We use a lot of very advanced design, health plan designs to make sure that we're focused on the needs of the population, but also the cost. We do a lot of Medicare reimbursement chassis. We do fair market pricing chassis. We do have clients that just they like a PPO plan. So we've got every flavor of health plan that can be designed. We can embed the DPC doctor into it. So those are our major medical care plans as well. So we'll go on to the next slide. Just kind of pointing out, and everyone on this call should know that the build charges are this fantasy number that the fee-for-service world is just kind of made for nothing more than a good commercial. So I ignore build charges, but this does look at the difference between if we chassis a PPO and what those PPO allowables are versus a Medicare reimbursement plan. And so those two columns in total, you can start seeing how not only having a direct primary care doctor driving things, helping the health of the population, helping the customer service side, because patients love this, but also minding the finances of the self-funded health plan itself. So we see about 30 to 40% savings over a traditional major medical plan when we bundle ours together. So next slide, please. So that kind of is a quick walk. Really want to get into the questions part of this. And again, we can get on and on and on for hours on what we're doing, but that was a quick overview of what direct primary care is with MyMD Connect, plus the ability to chassis it into any health benefit program that would suit an employer's needs. So we've got contact information there. Certainly you can call the number, but everybody emails. So new prospects at MyMD Connect, that's a great entryway and funnel into our account managers. And we'd be happy to get with you, have one of our outreach specialists contact you as well. Also, HRO is a good point to get to us as well. We work with those guys and appreciate them.
Awesome. We appreciate it, Jeremy. And we do have some questions that we wanted to get to. And the first one just came in, actually, and it was just straight to the point. Can this help my company save money on healthcare costs?
This will save money on healthcare cost, period. We do not have a plan that does not save money. So the answer to that is yes. Numbers, medical plans for major medical coverage, again, we see 30 to 40% savings overall. The claims funding can be half or even better. I noticed your first slides there before I started. We also have a 700-man auto group, different from yours, it's millions in savings that take place. So
that's awesome.
Great question.
Yeah, absolutely. And so here's a couple of questions actually from a lung and sleep clinic. His question was, how can specialists like us associate with your team?
There's two ways, really. All of our health plans cover a specialist visit. So a lot of them utilize an outpatient PPO network, kind of a traditional approach. We have a lot of specialists accessible through there. That's not my preferred method. My preferred method is we work directly with specialists and either in a brick and mortar setting, or we have a lot of specialists that are available virtually, and we drive those referrals. So we love to find partners to work with our specialists. So on our website, mymdconnect.com, there's a way to join us as a specialist, and either on a virtual basis or let us know where you're at, because we've got lives in your area. We'd be happy to work with you. So a skill set of a direct primary care doctor, one of them is to understand which specialists are a good value and steer your patients towards them. So that's who we are. That's what we do. So we're happy to help with them. Marcus, I did see one of the earlier questions about, is this a telemedicine program?
Yeah.
Well, I think everyone needs to understand this is not telemedicine. Telemedicine is for acute care. Telemedicine is you get on an 800 number and you call a random doctor that happened to be in queue. It works like Uber. I mean, you can go from the hotel to the restaurant and an Uber driver will pick you up, and that's great. And then when you go back to the hotel, it's some other Uber driver picks you up. And I mean, you can make 16 trips and have 16 drivers. Telemedicine's like that. You just get who's in queue. This is one primary care doctor relationship per patient. And so the only difference is you don't have to make an appointment, take off a half day of work, sit in a waiting room and get 4 minutes with the doctor. This doctor's available all the time on your cell phone. So this is not telemedicine. It is a direct primary care doctor in your pocket.
Great. So you really get a chance to build a relationship, with that doctor and have them learn, about your situation, over time. That's great. Yeah, I like that. We did. And so a couple other questions, Jeremy. With the COVID or with all the COVID rumors, what do I do when one of my employees gets sick on a work shift and they can't get a doctor's appointment?
Well, I guess the better question is, what should you have already done? You should have already had MyMD Connect. So you could say, call your doctor, because you're an employer and you shouldn't even be addressing this question. Your employees need access to doctors. And during COVID, there's not been a better illustration of what we do and the value. We've been doing this for years. This was not, hey, what should we do now that COVID's here? But this really illustrates your people need doctors, and they need access to them right this second, not, hey, you need to leave work and don't come back until you figure it out. That's not guidance. You need to, I think the day of not having a doctor in your pocket, I'm going to go work for somebody else. I expect that if possible, that should be part of my employer health plan.
Yeah, absolutely. So the next question is about a restaurant in particular. So I'm a restaurant and we're struggling to bring employees back because of unemployment and some other current government benefits. Is there something we can offer that's cost effective and innovative that might be enticing for them?
Yeah. This is a real live question for us. You've got to sweeten the pot now as an employer, because you're competing against free money in the mailbox. That drives me crazy. But so for instance, the MyMD Connect virtual primary program, it's $38 for that benefit a month to your employee. So that's a really cheap thing you can offer to sweeten the pot. Say, hey, we have a new benefit. It's MyMD Connect. It's a doctor on your phone, and we're going to pay for that. So at that's our lowest price point, and that's a great way to attract people back, and it's a great thing to offer. So that's one thing I would suggest. Otherwise, you're just competing against mailbox money. That's hard to do.
Yeah, absolutely. No, that makes a lot of sense. So another says that I love the idea of a primary care contact at the fingertips of our employees with easy access and a low cost. Well, what about medication and hospital coverage?
So if you want hospital coverage, we need to embed that in a health plan. We would recommend one of our designed health plans because they're more affordable, but they can be paired with any other catastrophic vehicle for that risk, whether that's a health share or a traditional health plan. So either of those. Now on the prescription side, that can be dealt with in the health plan itself. But if not, if you don't have the budget to add a health plan to this type of benefit, we do have a pharmacy benefit manager that we work with directly. We have a Connect drug program that offers drugs at very, very steep discounts, both branded and on the generic side. We, of course, give guidance to extremely cheap drugs. But we're able to get those discounts. We're able to walk your patients through those depending on the drug. And we're also the doctors. So a lot of times you can pivot. If you hit a roadblock financially in one spot, you've got time to work with that patient and figure out a better, cheaper option for them.
Awesome. Well, no, we appreciate it, Jeremy. I mean, that was a lot of great information. I think a lot of different ways that you guys can be a resource and be used by all sorts of types of companies in different scenarios. So we appreciate you all taking the time to join us today and share your expertise and walk through this with us. You know, if you guys have more questions based on the conversation today, you can reach out directly to MyMD Connect and get in touch with JD or Dr. Jeremy. I know their information is on the screen here. And you can contact HRO, our benefits director, Jessica Myers. Her contact information is on the screen there, her phone number and her email. If there's anything we can do for you guys, we'd love to help out. Everybody on the webinar, within 24 hours, you'll have an email with a follow-up from this, and you'll have my contact information there as well. If there's anything else we can help you guys out with, there's so much that we do for our clients. We'd love to be a resource if we can. And as always, would love to hear feedback on topics of interest for you guys on future webinars. Please send those my way, and we'll get working on some new content for the future. Thanks for joining, and thanks, Jeremy. Good job, guys, and that'll do it for us today. You have a good rest of the week.